Hi students, welcome to the new video. This video I am doing for you to understand about the immunofluorescence and the diagnostic technique of vesicular-bullous lesions. Because when you are studying skin lesions, you will see this question many number of times about direct immunofluorescence and indirect immunofluorescence. So to know about this direct immunofluorescence and indirect immunofluorescence, please see this video so that it will be easy for you to understand when you are learning the skin lesions. Okay, I prefer you see the video first, this video first, so that you will understand about DIF when we talk about different lesions. So to diagnose the skin lesions, we are using a technique called direct immunofluorescence and indirect immunofluorescence. So immunofluorescence Okay, immunofluorescence. So this is a fluorescence, means some light we are using, some dye we are using, which is what giving fluorescence, and we are using a microscope called a fluorescent microscope. Okay, fluorescent microscope. To see fluorescence, we use fluorescent microscope. It is not a normal microscope we are using, fluorescent microscope. Now, to diagnose skin lesions, we can use two techniques. One is direct immunofluorescence, other is indirect immunofluorescence. So, what is direct immunofluorescence and indirect immunofluorescence? Okay, so direct immunofluorescence is nothing but you have a patient. Okay, think about you. There is a patient coming to you. You are sitting in your clinic, and there is some kind of skin lesion in his hand or in his body. So you know that most of the skin lesions are antigen antibody related, right? Antigen antibody related. So the antigen, where is the antigen present? Where is the antigen is present? Antigen is present on the skin, right? So this person, if this person is normal, he will not have that antigen, means problematic antigen there, right? When if he is abnormal, he will have that problematic antigen there, okay, on the tissue. So in a normal person, the antigen will be normal, no issues. But if the person is having this disease, okay, well, the person is having this disease, what happens is that this tissue will have the defective antigen there, and it will give response, right? So in direct immunofluorescence, what you are going to check, you are going to check directly the antigen. Okay, so you are going to directly check the antigen, and what you are going to do, you take a biopsy. You do a biopsy of the lesion. You take a sample of the lesion. You are taking the skin sample of this patient. I took the skin sample. I took the skin sample of this patient. Okay, I'm taking the skin sample. What I am going to do, I took the patient's skin sample. Now what I do is that I apply a fluorescent labeled antibody. I am putting fluorescent labeled antibody. What is fluorescent labeled antibody? All antibodies are not labeled. This is particular antibody to see under microscope. See, you cannot visualize a thing in the fluorescence microscope or in the fluorescent microscope until it has some fluorescence. So there are certain dyes which give fluorescence. Okay, so we are putting antibodies. So we have, I took a skin sample. I took a skin sample. Now I will put an antibody against this disease. I will put an antibody against this disease. This antibody will be fluorescent labeled. This antibody will have a fluorescent label. Okay, so I took the skin sample. I took the antibody with the fluorescent label. Now, what is this antibody? This antibody I bought it from the market. And this antibody will say that this whether this patient will have pemphigus, whether this patient will have pemphigoid. So the antibody differs. You know, the antibody for your target is antigenic target differs, right? So what I will do, I put this, and what happens? It will go and bind to the antigen. Okay, this antibody will go and bind to the antigen. So they will go and bind. When will it bind? Only if there is an antigen. Only if the desired antigen is there in the skin, then only the antibody will go and bind. If that antigen is not there, that will not bind. Okay, so I put this there. If there is antigen, they will have an antigen antibody reaction. Okay, there is an antigen and antibody with this fluorescence will bind and make a complex there. If there is no antigen, this is not going to bind. When I wash it, it will go. But if there is an antigen, my antibody will go and bind it, and whenever even if I wash it, it won't go. And then I will go and see under the fluorescent microscope. Okay, I will go and see under the fluorescent microscope. It will give a positive fluorescence. Okay, it will give positive fluorescence. What do you mean by this fluorescence? That yes, that antigen is there. Okay, that's why our antibody worked. Okay, that antigen is there. So this patient is having this disease that is called direct immunofluorescence. Okay, so we are directly doing it in the skin of the patient. Okay, if you are doing it directly on the skin of the patient, it is called direct immunofluorescence. Now, what is indirect immunofluorescence? We are not taking the skin. We are not taking the skin, or we are not taking the sample of the patient. We are going to take the blood of the patient. So we need serum here. We are going to take the serum. Now, why are we taking the serum? So if you have a disease, if a person is having a disease, he have an antigen antibody or autoimmune disease, his antigen will be at the site while antibody will be circulating in the serum. Okay, this time I am going to take the serum of the patient. I am going to check whether this antibody is there in the serum of the patient. So here I am going to check the antibody. I am going to see whether this patient has the antibody circulating in his serum. Okay, so if I identify that okay, this antibody is circulating in his serum, then I can know that okay, this guy is having disease. That's why the antibody is in his serum. Right. So what will I do? I took the serum. Now I have to check for this antibody. What I will do? I will put it on a surface. Which surface? On monkey esophagus or monkey skin. Okay, monkey skin, or I will use a monkey skin. That is an what exotic medium. Okay, and a different medium. And on the monkey skin, I will put this antibody. Okay, I will put this antibody. Now this antibody will what it will do? Antibody will go and I will attack the monkey skin, and it will cause a split there, or it will cause a what fluorescence there. Okay, it will cause a fluorescence there. This antibody, okay, the antibody which I got from the serum, I will put on the monkey skin. I put along with the monkey skin, I will put a fluorescent marker. Okay, which will go and bind to this antibody. Okay, I will put a fluorescent marker which will go and bind to this antibody. So what happens if that antibody is present? It will give fluorescence. Okay, that much is enough. So indirect immunofluorescence, we check for antibody circulating in the serum. Direct immunofluorescence, we check for the direct antigen on the tissue. So this is the main difference between a direct immunofluorescence and indirect immunofluorescence. Okay, so you will see this in your what options. DIF of pemphigus, DIF of pemphigoid. Okay, so you see when you see the what other videos, you can see that how the DIF works. Okay, how it will help in diagnosis. Okay, so that's about the diagnosis part of the vesicular bullous lesions. Okay, so see you in the next video with a new topic.